I would like to call Dr. Mudita Jain for her topic on cosmetic procedures and enhanced quality of life in midlife women. Mudita is our very good friend and she's past secretary of Bhopal Obs Gynae Society. She's from Bhopal. I welcome you, Mudita. I would like to call Dr. Harita, Dr. Rupa Prakash, and Dr. Dolly Mehra, ma'am, for chairing the session. Please.
नहीं नहीं पेन ड्राइव में ही है।
My presentation or going to the data or uh, reading all the slides, I would like to talk about two women in my clinic. So, भैया hand वाला mic है क्या? So, two women in my clinic. One age 45-year-old. She is a principal in the school. She is financially independent. But when she came to my OPD, she was silent. Then she quietly told me, Madam, I am not very much comfortable to get intimate. I am not feeling myself comfortable. I am not into meat. I don't feel कि ये मैं खुद पुरानी वाली खुद हूँ. I feel dry. I feel pain. The second patient, the second female, what we are going to discuss is 55-year-old having previous 2 normal deliveries. Now she's saying, Madam, I leak urine. I had talked to multiple people. They said, no, urine leakage is very normal. But I feel ashamed. I am not able to go to my parties. I don't able to attend any family functions. I sit quietly at a corner. I am not feeling comfortable to wear light color saris. So what should I do? So here comes the role of our regenerative gynecology. So how we are going to enhance the quality of life in midlife women? So you know why this topic matters to us. This topic matters to us because we are not going to improve their life, we are going to bring their confidence in themselves. We are not going to stop our life because we are perimenopausal or menopausal. So midlife women will start from the age of 40 to 60 years. So the shift is from survival to the quality of life focused. So they are not just asking to survive menopause, they are asking to live confidently through it. We are seeing increasing consultation for vaginal dryness, laxity, urinary symptoms, and aesthetic concerns. As gynecologists, we must respond them scientifically and not dismissively. So what are the common midlife concerns? So the classical, in our clinical practice, we see genitourinary syndrome of menopause, vaginal laxity, stress urinary incontinence, dyspareunia, reduced libido, and vulval atrophy. So these are not cosmetic problems alone. They directly affect the intimacy, self-esteem, and relationship of a female. So if we want to understand genitourinary syndrome of menopause, so nearly almost 50% of postmenopausal female face it. So symptoms like dryness, burning, dyspareunia, recurrent UTI are significantly impacting quality of life. While we are going to give them local estrogens, which is a gold standard, many women seek non-hormonal options, and that is where energy-based devices come into the role. So energy-based devices can be fractional CO2, Nd:YAG lasers, which are collagen remodeling and neovascularization providing. They improve vaginal health index scoring, and they are also useful in GSM and mild SUIs. So Thermiva or RFA can also be used. They are also having collagenal tightening, improved lubrication, and they are having minimal downtimes. PRP has already been discussed, where we give autologous growth factors are clitoral and anterovaginal wall, libido enhancement, and emerging, but there is little evidence regarding PRPs. More RCT trials has to be gone, and our data, Indian data is not there for PRPs at present. Then comes hyaluronic acid fillers, where we can resume labia majora. Not only we resume the anatomy of the labia majora, but we also improve their sexual activities. They feel comfortable while making relationships. So they improve volume, they improve cushioning effect, as well as they improve the aesthetic effects. So the G-spot augmentation, the most common commercialization of spot augmentation is, so it's a very controversial topic. For G-spot, you can use PRP, you can use hyaluronic acids. So, but as senior practitioners, we must avoid commercialization without any scientific effects. So labioplasty has been discussed. It can be trimming and wedging effects can be there, but you need to have proper patient selection. You need to rule out dysmorphic figure problems. You need to rule out psychosexual disorders in the patient. Otherwise, you are going to face, you can say, disaster in your practice. So counseling must be there and expectations should be real. आप किसी को ये नहीं बोल सकते कि आपने आज ये इंजेक्शन लगवा ले तो कल आप एकदम शॉर्ट में चले जाएंगे. No, it's not like that. So patient selection should be there. The demand should be realistic. So coming to vaginoplasty and perineoplasty, so it can be post-obstetric trauma correction, we can do vaginal tightening, we can improve post-coital satisfaction. However, along with this, we need to have pelvic floor physiotherapy. RF or laser support is secondary for that. So the key is functional restoration, not just the cosmetic restoration. So we need to realize that cosmetic is a part, but functional restoration is a must because she is asking you for dignity and vanity, not for beauty purposes. So stress urinary incontinence, we had discussed a lot about different type of lasers, RFs, pelvic floor therapy and all. So whenever we see these two things are very overlapping, the functional part and the aesthetic parts. So we need to provide and use this combination for providing better sexual confidence, enhanced body image. A holistic women wellness should be avoided. So patient selection criteria is a must. We need to do psychological screening. We have to take detailed history examination. Realistic expectations should be met, and exclusion of any major prolapse and malignancy should be avoided. Any active infection should not be there. So the contraindications are active infections, malignancy, severe prolapse, and unrealistic expectations. So considering the ethical considerations, as leaders in OBGYN, we must not avoid over-medicalization. Evidence-based recommendations should be there. Informed consent is mandatory. In fact, you can have open consent because they read from ChatGPT, they read from AI. So you should have open consent that this we are going to do, this can be this, your results can be like this. So a proper consent should be there. And definitely body dysmorphic disorder screening should be there. So the evidence-based overviews agar we are talking about, then laser shows improvement definitely in GSMs. PRP is promising but needs more RCTs, randomized control trials, surgical procedure effective when selected well. So we must continue contributing Indian data to global literature, then only we can improve this branch. So this is the multidisciplinary approach. The future directions, this is a regenerative medicine, standardized guidelines should be there, stronger clinical trials should be there, multidisciplinary integration should be there. Midlife women deserve structured, safe, scientific, aesthetic care. So, if we talk about friends and colleagues, midlife is not a disease, menopause is not a failure. Aging is not a deformity, but suffering in silence is not acceptable. If a woman is pain-free during delivery, we celebrate it. If she survives cancer, we celebrate it. Then why should we hesitate to help her regain confidence, intimacy, and self-esteem? So, it is about cosmetic gynecology. Our FRAG is about restoring identity. It is about making intimacy painless, making laughter fearless, making self-image confident again. However, and this is important, we must lead this field, not allow it to be led by non-scientific peoples. Because as we have seen in stem cell therapy, it has been completely commercialized. If we are going to give this in the hand of pharma, then this will be a commercialized procedure. We won't be able to provide our functional uses. They can give you cosmetic surgery, they can see you, we can make you Mona Lisa smiles, we can make your vagina looks like any heroine you mentioned. Or so it's not like, so we are not pharma laden, we are gynecologists. We had treated high risk pregnancies, we had treated preeclampsias, we had treated n number of diseases, but now this is the branch where we should not avoid the desire of the female. We need to give them dignity by using these procedures. So we must ensure evidence, guidelines, interventions, ethical guide intentions. Let us recognize them as quality of life determinants, because sometimes restoring confidence is as powerful as saving the life. Thank you so much. मेरे दोस्त लोग बहुत लेट आए हैं मेरा लेक्चर खत्म होने के बाद.
Thank you, Mudita, for a nice talk. I would like chairpersons to present memento to Dr. Mudita and Dr. Vishal Rampuri. Please come forward for the memento.